but it is not the same. It is definitely not the same because there are technology issues. The interaction is not as flowing and easy as it is in a classroom. So the learning context is very important, and then the assessment environment and processes are also very important because, for example, in our current situation, the assessment environment and the processes are different. So we need to look at these four issues: the level of the students based on our interaction with them and their previous performance. We look at the nature of the course, we look at the learning context, and we look at the assessment. Particularly, when we look at the assessment, is assessment and examinations appropriate? Is the levels of the students level considered? Was the standard setting performed? So we look at this as far as assessment environment is concerned, and based on that we make predictions. So what sort of predictions? We have two aspects we use for normalization. The first aspect, do we expect a normally distributed result? Do we expect it to be normally distributed? Or because of the nature of the course, because of the teaching learning context, because of the assessment environment, we expect more students to perform less than before, so we expect it to be skewed to the left. Or maybe we did well because of the situation, we exerted more effort, the exams were suitable, the learning context was okay, the nature of the course is an easy course, so we expect the result to be skewed to the right. Or maybe everything is optimal, so we expect a normally distributed curve. So the first judgments you need to pass: do you expect a normally distributed curve or not? Do you expect 70% of the students is around the average performance, and that only 10-20% top performance, or only 10% non-performance? Or do you expect it to be the normal bell-shaped, where 50% are around the mean and 20% on each? You need to pass an overall judgment based on the assessment of the whole learning environment. So these are the different expectations, whether you expect skewness, whether you expect kurtosis, or whatever. So you make a judgment, an expectation. It's called the expected level of performance based on analysis of the students, the course, the learning environment, and the assessment environment. Based on that, you say, I expect this type of curve. When I plot the curve after the exam, I compare it to my expectations, and if I expect it to be skewed to the left, and then find it skewed to the right, I need to correct that. I need to normalize. If I expect it to be normal and I found it skewed or platykartic or whatever, then I need to normalize because of any of the four aspects. I expected a particular level of performance, and the results are not consistent with my expectations. I need to normalize. The other way, the other method other than the curve is I expect the mean and standard deviation to be normal. Mean and standard. I expect a normal mean and standard deviation. I expect the mean to be 70, and I expect the standard deviation to be around 10. If I found it diverting from that too much, then I need to normalize. This is regarding the whole result, not the result of one exam. So I can look at individual exams using any of the two methods we described, the Angoff or the Nadelsky. But once the result is done, I can look at the result again based on my expectations, how the result is going to look like, and then I can decide whether I'm going to normalize or not. The process of normalization, we will discuss it later. Now the floor is open for questions and discussions. You can ask questions about concepts, about processes, and you can comment if you like based on your worries.
Doctor, can I ask you a question,
Yes,
please?
please, Khadija.
Now, if my already students were not at normal distribution, I expected it to be normal distribution.
Uh-huh.
What can I do? If my expectation after putting the exam, I expected them to be as normal distribution, no skewness,
Okay.
and it appeared to be skewed. What can I do?
There is a process called normalization. We will go into the details of normalization on Tuesday.
Oh, okay. Okay, okay,
Okay?
thank you.
We will use
Okay,
statistical methods. Yes.
okay, okay, thank you.
When I teach students a lecture on nervous system and then I ask them any questions and they do not ask questions, I tell them, okay, so you either have understood everything or you have not understood anything. So I guess it is the first one. So it was clear, alhamdulillah. Okay, then I will see you on Tuesday to discuss the process of normalization. Yes?
السلام عليكم.
Yes, wa alaikum salam, Sameh.
Yes, doctor. Is it applicable for all types of questions? I think it's, in my opinion, correct me please if I'm wrong.
Yes.
Is it applicable? I think all of these criteria can be applicable more for MCQ questions or true and false, and less applicable on AC questions.
Well, if you bring content experts, context experts, and process experts, they can pass probability judgments using the Angoff methods. If, for example, you ask them to list, it's short answer, it's a short answer, or describe gram-negative bacteria. Describe gram-negative bacteria. Now, if you give this question to an expert and ask them, what is the probability that a borderline student can pass such an exam? In other words, if all my exams are like this one, what do you expect? What do you think the pass mark should be? So they can pass a judgment. Well, they will look at the question and they will think, okay, even borderline students can write acceptable answers for that, and I will give it about 65% probability, which means if all my questions are like that, the pass mark for such an exam for borderline students should be a 65. So it can be used even for clinical stations, clinical encounters, everything. If you bring expert judges, they can pass judgments using the Angoff method. And it's actually being used. It is used for different types of items, writing items and clinical performance items and everything. They can be used, but you need expert judges.
Okay, thank you.
Okay, sir.
Ramadan?
Yes?
I have a question.
Yes, please.
Can we change the pass average to lower than 60 if we consider the current situation, or even to a higher than 60 if we consider that they are students are staying in the home, they have more time to study, they have actually an open book MCQs, so can we do this? Is that acceptable or not?
This is what we are talking about. This is what we are talking about. You calculate either before or after, and what you are talking about is after. You are talking about norm reference. Because of the situation, because of whatever, we expected, and as Khadija said, I expected a normal distribution because I took everything into consideration when I prepared my exams. So I don't expect any skewness, and I don't expect I expect a normal distribution. But once I did the exams, it was a bit skewed to the right. More students are scoring A's. Why is that? This is not my expectation. So you need to normalize this abnormal curve. You do not change the pass mark. You use the pass mark, the calculated pass mark, your new calculated pass mark, to adjust or normalize the curve. But once you go to the system and enter it, it will be the normal mark. The pass mark is still 60 because you normalized the results. And we will discuss in detail the process of normalization.
Thank you.
Okay, thank you very much. By the way, this session is recorded, and inshallah we will put it in the Education Center channel. You can go back to it again.
تسلم.
Okay.
Thank you.
Okay.
السلام عليكم.
Thank you.
وعليكم السلام. دكتور
كيفك إن شاء الله طيب. Thank you doctor. Thank you doctor. It was really يعني interesting information and fruitful.
Thank you.
And we need it in this time actually to apply at least for one course or two courses, you know.
Please invite others because the discussion on Tuesday is very essential. The process of normalization. Invite others. We need it to be a wide discussion, wide-based discussion.
Okay.
Okay.